On Thursday, a group of whistleblowers had a meeting to discuss health violations from the FAA, or the Federal Aviation Administration. You know, the people that are flying you in airplanes when you travel. This meeting was put on by a group of advocates for them. They're called the U.S. Freedom Flyers, and they speak on behalf of people who work in aviation.
Yeah, so they had a big Zoom meeting. I mean, look at all the people who were in attendance in this Zoom meeting. There were a lot of people, whistleblowers, doctors, soldiers, pilots. The meeting featured a whistleblower, Senior Aviation Inspector McGray, Bruce McGray. He's a safety inspector at the FAA. He's leading the charge right now of people in the industry who are concerned with the way the FAA dealt with this pandemic, COVID and COVID vaccines overall. And this is one of the many cases, we've been discussing it here on the show, in which companies are facing litigation over these vaccine mandates, right? So,
yeah,
I mean, we're going to hear it from like Tyson Chicken and a whole bunch of other companies who are facing these vaccine mandate litigation right now.
Yes, but it's especially scary inside aviation because these pilots are saying we have been what they're calling vaccine injured, right? So they had some adverse reactions to taking something that was mandated for their field to keep their job. And if they are now continuously sick, well, that's an issue. One of the things that Inspector McGray points out is that the FAA has a policy currently still and always has had that no pilot may take a drug until it's been 1 year since full FDA approval.
What?
This makes sense, right? Obviously, who here, raise your hand if you want your pilot on something experimental, right? In case, right? I don't. I'm like this.
Alcohol is not experimental at all, and they don't let them drink.
And they're not allowed to drink, right? And they even have like,
sleeping.
Very strenuous sleep logs about all of that stuff, right? Now, again, this is the FDA's policy that no pilot may take a drug until it's been 1 year since full FDA approved.
This is the FAA. So let's not get our initialisms, or what is it? Initialism acronym mixed up.
An acronym is something you can pronounce as a word, like NASA.
Okay.
And an initialism is something that's not a word. So FAA is an initialism because we don't say FA.
Okay. So
unless we start, do you want to?
No. So the FAA has a policy that no pilot may take a drug until it's been 1 year since the full FDA approval of said drug.
And if they do, according to Inspector McGray, they don't get medical approval to fly. Now, despite this rule, the government used a blanket waiver for the COVID-19 vaccines without any documentary evidence and scientific studies. So this is an important question, right? Why was this vaccine given a pass when no other medication ever has? Clearly, it was not based on documentary evidence or scientific studies. We know exactly what started to be presented when human trials started, right? And so why? Why this political curveball?
And why wasn't Washington listening to this at all? Todd Callender is an attorney. He was on this call, the Zoom call. He kind of led it off, kicked off everything, kind of explaining how they tried to take this to Washington, to senators' offices. The only senator's office that even responded was Senator Ron Johnson's office. Nobody else got back to him. Listen to what Todd Callender has to say.
So we ran into deaf ears at the FAA. The Inspector General came back and effectively said, there's nothing to see here. We're not going to investigate anything. So we're going to take things into our own hands. That's what this is about. We're all here together because we know that we're not going to get any help out of Washington. In fact, this is a global problem, folks. This is every government in the world doing the exact same thing. We're not going to get any help from any of our governments. This was planned over at least 40 years, at least from a legal perspective. It is a
wow. And so I see people in our chat saying, wow, we're in the UK. We haven't heard anything about this. Imagine that. So when will you start hearing about pilots in the UK? When will you start hearing about these adverse effects? When will you start hearing about, the questions as to whether or not they should be flying at all because of being injured? Right.
Right.
Well, and that just shows you the influence of the FDA or of the pharmaceutical industry, because they even got the FDA to agree to block that trial data from being circulated for 75 years. The FDA was going to do that for the pharmaceutical industry. So this is 100% the influence of the pharmaceutical industry.
Yeah.
Right.
You're right.
Well, but the FAA, according to this call, had concerns about the COVID vaccine as early as October of 2020. So this screen was shown during the call. It was from an FDA internal audit presentation, and it lists what the FAA was concerned about if and when these vaccines would start to be implemented. Now, it's interesting because it reads like a laundry list of what actually happened, right? Of what was actually happening in clinical trials.
Stroke, Guillain-Barré syndrome.
Especially from the Pfizer documentations that we've
Myocarditis?
read to you here. Yes, right? Preemptively, the FAA was concerned about myocarditis.
So the FAA was concerned about these vaccines and this list, myocarditis, and troubling because you're sitting for long periods of time. If you're a pilot too, like thrombosis, and also blood clots, right? These are troubles when you're flying for long periods of time. It's sitting for long periods of time.
Yeah, exactly. Right. And, inflammation is something that exacerbated when one flies. So you would think that people who work in the air would have a reason to be concerned about anything that would make their time in the air worse, right?
Right.
Yeah.
Well, and we think about like inflammation, right? So like myocarditis as an inflammation, we were talking about this before the show. When you get on an airplane, you get like, you get chubby, right? You get fat, right? You feel
you get bloated.
You get bloated, you retain water. That's why,
that's why you get kind of farty and burpy.
No, you dehydrate quickly. That's why they give out water, right? So there's all sorts of weird stuff that happens to your body. So there's already like an inflammation happening to your body when you're flying anyway.
Yeah.
So you would think that they should be more concerned about some of these things that are layered on top of your already sort of bloaty, farty flying body, right?
Yeah. Farty and burpy.
That's my medical opinion.
Okay. Thank you for that. Now, Inspector McGray further said that the FAA covered up vaccine mandate protests. For example, in Jacksonville, at the time the media was reporting these walkouts from air traffic controllers, people who were walking out over the mandate, right? And it shows here that the FAA took to Twitter and said, no, these are not, this is just normal, nothing to see here, traffic, staffing shortages.
It was just delays and weather, right? They said widespread weather, severe weather.
Yes. So if you look at their report on their reply on Twitter, do we have that?
Oh, do we?
There we go. This is from just around those same time, October of 2021. Nothing to see here. Totally fine.
Severe weather.
Traffic shortages. Nothing.
I mean, could you have looked this up on a weather app?
Sure. And weather is almost inconsequential because, you can always say there's pressure or.
Right. There's a little cloud. There's something.
And,
there's a storm front coming.
What do you know
It's
about
a weather
pressure?
balloon.
Right.
Yeah.
There's a nut loose on the wing.
Yeah.
There's a nut loose on the tarmac running around. We have to capture this guy. So Lieutenant Colonel Pete Chambers, he's a doctor who holds the rank of Lieutenant Colonel in the National Guard, was himself injured during COVID. Well, you can figure out why. He saw other members of the military also injured as well. He was on this call. He says, we are at a pivotal moment right now in our history. Listen to what he said.
What I'm going to talk a little bit about today is where we're at. And where we're at right now on the 30th of August, 2022, is we're in the midst of discussing something that's a line of effort. That's something that represents a clear and present danger to humanity. Okay, this is just a line of effort. This is only one. There are others out there. And it's not only humanity, but we bring it down to the tactical level now, and it's our loved ones we put on planes. It's these pilots that are in the air.
Yeah. So think about that, right? What a conundrum. And we should point out some of the great reporting on this. I wanted to pull up her Substack if I can in a second, but just think about I'm going to pull up because I want to pull a quote from her reporting here. It's what a conundrum it is to be a pilot thinking, I can't come out with this. I can't talk to the FAA about this. And by the way, The FAA is well known, like you do not speak out about things you've seen in the air. You don't talk about things that are problematic to the FAA. Like, this is well known. Now, I interviewed President Obama's pilot, Air Force One pilot. Okay. And I can send you this. I'll put it in the description below. You can see my interview with him. And he said, we're not allowed to talk about UFOs. We've all seen them. We've had interactions with craft while we're flying. And I asked him, why don't you talk about these? Why are you now coming out about this? Why don't we hear more pilots who fly commercial airline? He goes, because you will lose your job. You will lose your job if you talk out about this stuff. And you're worried about losing your job. Where do you go? Like, if you've been in the Air Force or you've been, a pilot in the military, right? Where do you go after the military? You go to commercial aviation, right? Well, if you lose that job, where then do you go? Where do you go? Like, start flying drug runs out of Guatemala? Like, what do you do if you don't then have the opportunity to be, under the FAA's supervision and running commercial airlines, right?
Mm-hmm. So further, let's say, who is this next thought? I didn't see this one.
Oh, okay. This is, sorry, I was trying to pull up, I was hoping you would give me a break and take that while I pull up the,
Well, okay, a lot of the other things that are listed in this, that were spoken about in this whistleblower call, were things that we have all taken issue with. For instance, why were vaccines given a pass for all sorts of, why were the vaccines that were given approval, why were we kept in the dark about clinical trials, why, these are things that are not specific to aviation. They're specific to all of us.
So I wanted to call out the great journalism, and who put a lot of this work together is Etana Hecht. And I hope I'm saying your first name right, Etana. So you can read her Substack. I love the name of her Substack is Clown World. So writes journalists over at Substack. So go and support her work. We need to support independent journalists. So she writes this. She's been following this story, and she says, she says, where does the liability land? A multi-billion-dollar corporation created a product. That product got hyped within an environment of panic, fear-mongering, social pressure, media adoration, guilt, government pressure, and finally, financial pressure. So then here's the pilot part of this. I want to read this. A pilot succumbed to that pressure, got vaccinated, boosted per his company's coercion, and is now suffering from chest pains, neurological oddities. That pilot now faces an impossible choice. Report his medical issues and risk losing everything that he's worked for, or keep quiet, continue flying and pray. And if he reports his concerns, he'd be grounded for an undetermined amount of time and put on medical leave, during which time he'd receive a fraction of the salary that he got from flying.
So what he did was actually protect himself with whistleblowers laws and say, well, then I'm going to have to blow the top out of the whole industry, or else, because at least I'll be protected.
Right.
So, thankfully we still have those with whistleblower laws to protect people like this who want to speak out.
So Josh Yoder is the co-founder of Freedom Flyers, says he hears from pilots all the time on these issues from vaccines, that they are afraid to speak out about it, and they are afraid to come forward because of the FAA. They've set up basically a way for people to come out and talk to them personally, and they're setting up an email to be able to contact them directly. Well, they'll take care of your private information, not share it publicly at all. So he says he hears from these guys all of the time. Listen.
I hear from hundreds of people literally every single day. My phone rings with someone who's vaccine injured, often within the airline industry, but not always. And I know that there's many people out there that are currently flying with vaccine injuries, specifically cardiac and neurological conditions. These are the things that I hear about the most.
Neurological conditions among your pilots.
So, this is a population that we obviously want in tip-top shape, right?
Right.
We absolutely all want to look into this. And it has to not be taboo to say these things in order to do it.